Welcome back to The Explainer. I'm Dr. Evidentia. Today, we're decoding the clinical evidence behind the hidden warning signs of cardiovascular emergencies. We've got some truly fascinating medical research to dive into, bridging the gap between one completely baffling clinical case report and some massive population data. Because, as it turns out, we have a huge blind spot when it comes to our collective health literacy.
But right off the bat, I have a pretty serious question to ask you. Could you be ignoring a ticking time bomb inside your own chest? It's a terrifying thought, right? But as we're going to see today, the subtle warning signs of major heart issues often disguise themselves as everyday fatigue or just anxiety. They can fly completely under the radar until a massive event strikes. Now, real quick, before we dive into the clinical evidence, please remember this explainer is strictly for educational purposes. It's not personalized medical advice. Always check in with your own physician regarding your specific health needs before making any medical decisions. All right, let's get into it. Section 1. The Hidden Heart Defect, a 42-year-old's medical mystery. Let's start on the micro level with a really gripping clinical case report published in the medical journal Curious. So picture this. A 42-year-old woman rushes into the emergency department experiencing sudden 10 out of 10 retrosternal chest pain. That means agonizing, severe pain right behind her breastbone. And it's radiating all the way through to her back. This terrifying episode lasted for 10 solid minutes.
And what makes this case so incredibly compelling is her profile. We're talking about a young, generally healthy non-smoker with a completely normal body mass index. Yet she was utterly convinced she was having a massive heart attack. Now, her initial tests in the ER, like her EKG and chest X-ray, they came back completely normal, unremarkable. But her symptoms were telling a totally different story.
Turns out, the real clues were buried deep in her past. When she was a kid, she fainted during a school field day and was told she had an asymptomatic mitral valve prolapse. But, crucially, there was absolutely no medical follow-up. That single, ignored childhood fainting spell literally laid the groundwork for her adult emergency. And it was preceded by these subtle warnings she'd just been brushing off, worsening fatigue, moments where she almost fainted again, random chest pain, and heart palpitations.
So after digging a bit deeper, outpatient imaging finally solved the mystery. This actual cardiac MRI from the case report definitively revealed the culprit. It showed a large sinus venosus atrial septal defect alongside a partial anomalous pulmonary venous return. Okay, I know that sounds like an absolute mouthful of medical jargon, so let's break down exactly what that means.
In everyday, plain English, she had a severe congenital heart defect. Basically, she was born with a structural hole between the upper chambers of her heart, and her pulmonary veins were dumping blood into the entirely wrong room. On top of the whole shebang, her mitral valve, think of it as one of the heart's main doors, had degenerated over time. These issues went completely unnoticed for 40 decades, just silently wearing out the right side of her heart.
This case brilliantly illustrates how structural heart disease can progress in total silence. It starts way back with an asymptomatic defect in childhood. Without any follow-up, progressive mechanical stress just builds and builds over decades. Eventually, this culminates in right-sided heart failure and those severe acute symptoms she felt in the ER. It's a huge wake-up call that brushing off subtle early clues like unexplained fatigue or a fluttering heart can have some really drastic consequences.
So before we zoom out and look at the massive population data, I'm curious, let me know down in the comments if you think you'd actually recognize these subtle warning signs in yourself, or maybe in a loved one. And hey, if you're finding this evidence-based breakdown helpful so far, definitely consider giving this explainer a like and subscribing so you never miss a health update.
Section 2. The Knowledge Gap. Zooming out to the population level. So we're transitioning from this one single patient's missed chronic diagnosis to look at a massive global blind spot regarding acute cardiovascular events, specifically strokes and heart attacks.
To really grasp the scale of this, we're looking at a staggering cross-sectional study from the Korean Community Health Survey. Researchers analyzed data from over 228,000 adults. That is a massive sample size. And they strictly tested their baseline cardiovascular health literacy.
And the results? They clearly revealed that just like our case study patient who missed the signs of a chronic condition, hundreds of thousands of people out in the general public are dangerously unaware of the life-threatening acute warning signs of a heart attack or stroke. Remember, time is tissue when it comes to the heart and the brain. Recognizing these signs early is literally the difference between life and death. When they actually tested symptom identification, this massive knowledge gap became crystal clear. Get this, sudden poor vision was only recognized as a stroke symptom by 66.1% of people. And even worse, only 53.8% of people identified arm or shoulder pain as a sign of a heart attack. That means nearly half the population has absolutely no idea that arm pain can mean your heart is failing.
People also dangerously misunderstood other classic cardinal signs of a stroke. Far too many folks fail to recognize things like sudden numbness or weakness on one side of the body, sudden confusion, difficulty speaking, loss of balance, or even a sudden, severe, unexplained headache. These are major red flag emergencies, yet they're going widely unrecognized.
Overall, the study found that nearly 1 in 5 participants, that's 19% of the population, had a dangerously low understanding of these critical cardiovascular warning signs. They scored less than a 4 out of 10 on just a basic symptom awareness test.
Moving on to Section 3. Who is most at risk? The demographics of misunderstanding. Because if we actually want to fix this problem, we need to know exactly who is falling into this massive knowledge gap.
The established evidence from the survey clearly shows that socioeconomic factors play a huge role here. Older males, individuals with a lower education level, and those who are unmarried, unemployed, or of poor economic status are at the absolute highest risk of missing these crucial cardiovascular warning signs.
On top of that, poor health behaviors correlate incredibly strongly with critically low symptom awareness. People who don't get regular exercise, those consuming a high-salt diet, skipping regular health screenings, and carrying high perceived stress are way less likely to know the science. And unsurprisingly, those who already have pre-existing conditions like high blood pressure or high cholesterol also scored super poorly.
Which brings us to a pretty terrifying conclusion. The clinical irony here is just chilling. The exact demographic most at risk for actually having a stroke or heart attack, older men with poor diets, high stress, and existing vascular issues, is the exact same demographic least likely to recognize it's happening to them. They are literally the most vulnerable, yet the least prepared.
Section 4. Empowering your health decisions. Why this evidence matters. This brings us to the core reason why understanding this medical evidence is absolutely critical for the future of your health.
My mission as Dr. Evidentia is to empower you to make informed health decisions through reliable evidence. Whether it's a hidden congenital defect quietly progressing for 40 years or a sudden blockage causing a heart attack, awareness is your very first line of defense. As we've seen today, early recognition is really the only way to prevent poor clinical outcomes. You've got to know your body, understand the baseline signs of distress, and always advocate for proper medical follow-ups.
So to sum it all up, ignoring subtle early symptoms and having poor health literacy leaves massive dangerous gaps in our baseline cardiovascular awareness. It puts the most vulnerable demographics at extreme risk. I'm going to leave you with this final provocative thought. You might know the signs now, but would the people you love recognize a heart attack or stroke if it happened to them? Will you share this explainer with them to ensure they do? Knowledge is quite literally a lifesaver. Thank you so much for joining me today. Keep asking questions, and I'll see you in the next explainer.